In this video, you will learn more about the use of the ultrasound device for measuring muscle health. This demonstration is presented to you by Human Movement Sciences students Alexander, Remy and Erin. Ultrasound is an imaging method in which sound waves are used to visualize tissues, organs and other body structures. Based on the speed of the reflected sound and the time for the echo to be returned, distances from the transducer to the body tissues are determined. The ultrasound program then translates these signals into two-dimensional images. Besides the visualization of muscle structure and architecture, muscle ultrasound is also able to visualize muscle movements in a non-invasive manner. Prior to the ultrasound measurement, some preparations are needed. First, ensure you have an appropriate amount of gel and tissues. Place the bed and ultrasound correctly and make sure to apply the brakes to the bed. Next, start up the ultrasound program by clicking on the application. Lastly, the technician should be familiar with the placement of the transducer. Cenium.org can be used for guidelines on correct placement. It is important that the patient is wearing suitable clothes for the measurement taking place, so the measurement location can be easily accessed. Briefly explain to the patient what an ultrasound measurement entails and what is expected from them throughout, such as contracting or relaxing the body when necessary. Position the patient correctly on the bed. This is important to avoid any measurement errors due to inconsistency throughout. Apply the right settings for the measurements. Frequency is 8 mHz, focus is 45 to 64 mm, depth is 50 mm. Distinguish the proximal and distal end of the transducer by placing your finger on each end of the probe and viewing the monitor. Determine the placement of the probe. For the vastus lateralis, this will be 2/3 of the way from the anterior superior iliac spine to the lateral side of the patella. For comparing measurements over a time period, surgical markers can be used on the patient's skin to mark off the area of the muscle belly which is being measured. Next, apply the gel to the transducer. The gel keeps air pockets from forming between the transducer and the skin, which block ultrasound waves from passing into the body. Ensure the transducer is facing in the direction of the muscle fibers. Apply only minimal pressure on the transducer, as excessive pressure may influence muscle size determination. Once you have captured a suitable image to view, use the spacebar to freeze the image on the screen. Once a suitable image is captured, measurements on the muscle characteristics can take place. With ultrasound, muscle thickness, pronation angle and vesicle length can be determined. Firstly, select the distance feature to clearly mark both the superficial and deep aponeurosis. Next, draw a perpendicular line connecting both aponeuroses. This will determine the muscle thickness. Next, you can use the angle feature to determine the pronation angle. Simply draw a line on a vesicle to the deeper aponeurosis. Secondly, draw another line along the aponeurosis relative to the vesicle line. The angle formed reflects the pronation angle. Lastly, you can use the distance tool to determine the vesicle length. Locate one vesicle and connect the point where the vesicle meets the superficial aponeurosis to the point where that same vesicle meets the deep aponeurosis. The created line is the vesicle length. Using key 9 will save the image, which can be compared with new measurements over a time period to help detect muscular atrophy in the patient. When the measurement is finished, make sure to appropriately clean the transducer, removing any excess gel. Finally, make sure that the patient has a sufficient amount of tissues so that they can remove the gel from their leg. By following these steps, you can accurately determine the muscle architecture with ultrasound imaging. In clinical practice, these images can be used to diagnose muscular disorders like sarcopenia and atrophy. In summary, there are several steps in carrying out an ultrasound measurement, both for preparation as well as during the measurement itself. It is important to familiarize yourself with the entire protocol. Thank you for watching.